Hey, it's time for an apple fritter. Here's your host, Jimmy Apple.
Welcome to another episode of An Apple a Day's The Fritter. I'm your host, Jimmy Apple. How you feeling today, my friends? You feeling good? You feeling strong? You feeling better than you did yesterday? Excellent. You can't ask for better than that. We have got a good one for you today. This subject is near and dear to my heart simply because I was treated for it on Christmas Eve. That's right. I had to have a procedure done to open up my right femoral artery on Christmas Eve morning at 8 a.m. They had to do an angiogram and an angioplasty in my right femoral artery, and they had to put another stent, a second stent in my right femoral artery. So today we're talking about what is peripheral artery disease. So sit back, relax, and listen to what David has to tell us today.
What is peripheral artery disease? Peripheral artery disease, P.A.D., is plaque buildup in your leg arteries. Your leg arteries carry oxygen and nutrient-rich blood from your heart to your arms and legs. Other names for this are peripheral vascular disease or peripheral arterial disease. Shaped like hollow tubes, arteries have a smooth lining that prevents blood from clotting and promotes steady blood flow. When you have peripheral artery disease, plaque, made of fat, cholesterol and other substances, forms gradually inside your artery walls. Slowly, this narrows your arteries. This plaque is also known as atherosclerosis. Many plaque deposits are hard on the outside and soft on the inside. The hard surface can crack or tear, allowing platelets, disc-shaped particles in your blood that help it clot, to come to the area. Blood clots can form around the plaque, making your artery even narrower. If plaque or a blood clot narrows or blocks your arteries, blood can't get through to nourish organs and other tissues. This causes damage, and eventually death, gangrene, to the tissues below the blockage. This happens most often in your toes and feet. P.A.D. can get worse faster in some people more than others. Many other factors matter, including where in your body the plaque forms and your overall health. P.A.D. is common, affecting between 8 and 12 million Americans. However, healthcare providers sometimes don't diagnose or treat P.A.D. enough. Actual numbers are probably higher. The typical symptom of P.A.D. is called claudication, a medical term for pain in your leg that starts with walking or exercise and goes away with rest. The pain occurs because your leg muscles aren't getting enough oxygen. The dangers of P.A.D. extend well beyond difficulties in walking. Peripheral artery disease increases the risk of getting a non-healing sore of your legs or feet. In cases of severe P.A.D., these sores can turn into areas of dead tissue, gangrene, that make it necessary to remove your foot or leg. Healthcare providers can use two different systems, Fontaine and Rutherford, to assign a stage to your P.A.D. The Fontaine stages, which are simpler, are asymptomatic, without symptoms; mild claudication, leg pain during exercise; moderate to severe claudication, ischemic rest pain, pain in your legs when you're at rest; ulcers or gangrene. The first symptom of P.A.D. is usually pain, cramping or discomfort in your legs or buttocks, intermittent claudication. This happens when you're active and goes away when you're resting. Symptoms of peripheral artery disease include a burning or aching pain in your feet and toes while resting, especially at night while lying flat; cool skin on your feet; redness or other color changes of your skin; more frequent skin and soft tissue infections, usually in your feet or legs; toe and foot sores that don't heal. Half of the people who have peripheral vascular disease don't have any symptoms. P.A.D. can build up over a lifetime. Symptoms may not become obvious until later in life. For many people, symptoms won't appear until their artery narrows by 60% or more. Talk to a healthcare provider if you're having symptoms of P.A.D. so they can start treatment as soon as possible. Early detection of P.A.D. is important so you can begin the right treatments before the disease becomes severe enough to lead to complications like a heart attack or stroke. Without treatment, people with P.A.D. may need an amputation, the removal of part or all of your foot or leg, rarely your arm, especially in people who also have diabetes. Because your body's circulatory system is interconnected, the effects of PAD can extend beyond the affected limb. People with atherosclerosis of their legs often have it in other parts of their bodies. Atherosclerosis that develops in the arteries of your legs, or, less commonly, your arms, causes peripheral arterial disease. Like atherosclerosis in your heart, coronary arteries, a collection of fatty plaque in your blood vessel walls causes peripheral vascular disease. As plaque builds up, your blood vessels get narrower and narrower, until they're blocked. Tobacco use is the most important risk factor for PAD and its complications. In fact, 80% of people with PAD are people who currently smoke or used to smoke. Tobacco use increases the risk for PAD by 400%. It also brings on PAD symptoms almost 10 years earlier. Compared with non-smokers of the same age, people who smoke and have PAD are more likely to die of heart attack or stroke, have poorer results with bypass surgery procedures on their legs, have a limb amputation. Regardless of your sex, you're at risk of developing peripheral arterial disease when you have one or more of these risk factors. Using tobacco products, the most potent risk factor. Having diabetes. Being age 50 and older. Being African American. Having a personal or family history of heart or blood vessel disease. Having high blood pressure, hypertension. Having high cholesterol, hyperlipidemia. Having abdominal obesity. Having a blood clotting disorder. Having kidney disease, both a risk factor and a consequence of PAD. Although PAD is a different condition from coronary artery disease, the two are related. People who have one are likely to have the other. A person with PAD has a higher risk of coronary artery disease, heart attack, stroke or a transient ischemic attack, mini-stroke, than someone without peripheral artery disease. A person with heart disease has a 1 in 3 chance of having peripheral artery disease in their legs. Not surprisingly, the two diseases also share some common risk factors. This is because these risk factors cause the same changes in arteries in your arms and legs as they do in your heart's arteries. A provider will perform a physical exam and review your medical history and risk factors. They may order non-invasive tests to help diagnose PAD and determine its severity. If you have a blockage in a blood vessel, these tests can help find it. Ankle brachial index, (ABI). Pulse volume recording, (PVR). Vascular ultrasound. You may also need an invasive test called an angiogram to find artery blockages. Some studies have shown that you can reverse peripheral vascular disease symptoms with exercise and control of cholesterol and blood pressure. With early diagnosis, lifestyle changes and treatment, you can stop PAD from getting worse. If you think you're at risk for PAD or may already have the disease, talk to your primary care doctor, vascular medicine specialist or cardiologist so you can get started on a prevention or treatment program right away. Lifestyle changes, medications and procedures can treat PAD. The two main goals of peripheral artery disease treatments are reducing your risk of cardiovascular events, improving your quality of life by easing the pain that occurs with walking. Treatment of PAD starts with making lifestyle changes to reduce your risk factors. Changes you can make to manage your condition include: quit using tobacco products. Ask your healthcare provider about smoking cessation programs. Eat a balanced diet that's high in fiber and low in cholesterol, fat and sodium. Limit fat to 30% of your total daily calories. Saturated fat should account for no more than 7% of your total calories. Avoid trans fats, including products made with partially hydrogenated and hydrogenated vegetable oils. Exercise. Start a regular exercise program, such as walking. Walking can help treat PAD. People who walk regularly can increase the distance they're able to walk before their legs hurt. Manage other health conditions, such as high blood pressure, diabetes or high cholesterol. Keep your stress level low. Exercise, yoga and meditation may help with this. Practice good foot and skin care to prevent infection and reduce the risk of complications. Peripheral artery disease is a condition you'll have for the rest of your life. Although there's no cure for PAD, you can manage it. You can help keep peripheral vascular disease from progressing in several ways: not using tobacco products, exercising regularly, limiting fat and following a healthy diet. Managing your risk factors, such as diabetes, high cholesterol and high blood pressure. It's important to take good care of your feet to prevent non-healing sores. Foot care for people who have P.A.D. includes wearing comfortable, appropriately fitting shoes, inspecting your legs and feet daily for blisters, cuts, cracks, scratches or sores. Also check for redness, increased warmth, ingrown toenails, corns and calluses. Not waiting to treat a minor foot or skin problem. Keeping your feet clean and well moisturized. Don't moisturize an area with an open sore. Cutting your toenails after bathing, when they're soft. Cut them straight across and smooth them with a nail file. In some cases, your healthcare provider may refer you to a podiatrist, foot expert, for specialized foot care, especially if you have diabetes. A podiatrist can help you with corns, calluses or other foot problems. Contact your healthcare provider if you get a bad infection in a sore on your foot. The infection can expand into your muscles, tissues, blood and bones. If your infection is severe, you may need to go to the hospital. Can't walk around enough to do normal activities. Have pain in your legs when you're resting. This is a sign of poor blood flow. Get immediate help if you can't feel or move your foot or if it looks different from your other foot's skin color. This means you've lost blood flow to your leg without warning. You have the ability to prevent peripheral artery disease, P.A.D., or keep it from getting worse by making lifestyle changes. Keep all of your follow-up appointments with your healthcare provider and vascular specialist, and take the medicines they prescribe for all of your conditions. Knowing the warning signs of P.A.D. complications helps you know when to ask for help, too. I hope you find this information helpful. Now, I'll pass this back to Jimmy.
Thanks, Dave. And thank you, the audience, for being here today. Before we go, I just want to pass along some personal information about P.A.D. If you think that you might have P.A.D., get to your doctor right away. It's a terrible disease to have. I've had it now for a few years. I had a stent put in my right femoral artery back in 2007. You would have thought that would have been the end of it. It opened it up, but it wasn't. My leg turned black, and I mean black, and I've had wounds on my leg that won't heal. They continuously come back, and I switched over to a new doctor last year, and thankfully this doctor was right on the money. She kept on looking at it, and this past December, when I was in the hospital, she said, no, we're going to have to do some more tests because the wounds aren't healing. And she did. She did more tests. Unfortunately, it was right before Christmas. She said, we're going to have to go in and surgically do this. And they did. It turned out to be Christmas Eve, but they took care of it. And right away, I noticed the difference in my leg. And I noticed the difference in the wounds on my leg. So if you think for 1 second you might have P.A.D., go right to your doctor. Don't be afraid. Don't think that you're being a hypochondriac. Go right to your doctor and let them know. And let them do the test. The test doesn't hurt, trust me. It's just big blood pressure cuffs. But anyway, thank you for being here today. And remember this. Things can always be worse. Right now, there's somebody somewhere wishing that they were in your position, so things can always be worse. And do me a favor. Be the reason today somebody smiles. It'll make you feel good. It'll make them feel good. And remember this also. An apple fritter comes out 5 days a week, every morning at 4 a.m. That's right, we're up early with the elves. We're out there making you a new apple fritter 5 days a week at 4 a.m. Check it out. And don't forget to check out our regular podcast on Friday nights. Comes out on Friday. We have new guests coming in for the beginning of the year. We have some really interesting guests. One in particular who talks to ghosts. That's right, coming up next week. So you're not going to want to miss that. We have some really good guests coming up in January. We have some booked for February already. Make sure you check us out. We'll be putting out the itinerary, if you will, the schedule of who's going to be on, so make sure you watch out for that. I'll talk to you again real soon. You've been listening to an Apple a Day, the Fritter. I'm Jimmy Apple, and I'll talk to you again tomorrow, my friends. Have a great one.
Join Jimmy tomorrow for another Apple Fritter. In the meantime, stop over at our YouTube group page, Living with a Disability, join in the conversation and make some new friends. See you next time.